Hello, good morning everybody. Today's topic is histology of this epithelium. So first define what is the definition of this epithelium. It is an avascular tissue consists that cover the outer surface of the body. So it is an avascular tissue consists one or the more layer of the cells that cover the outer surface of the body, line the luminal surface of the tubular structures and cavity of the body are called the epithelium. So epithelium also form the secretory portion of the glands and their ducts and are and receptor of the certain sensory organ. So the definition of this epithelium is one or the more layer of the cells that cover the outer surface of the body, or the line the luminal surface of the tubular structures and cavity of the body are called the epithelium. So name is given this epithelium. So what is the general features or the characteristics? So they are closely opposed and adherent to one another by means of the spatial junction. So very little intercellular space, usually avascular, and non-nourishment is by diffusion from the adjacent supporting tissue. All cells are rest on the basement membrane. Cells show polarity. Cells show surface modification, good regenerative capacity, metaplasia. Change from one type to another can take place, derived from all three germs layer. So these one are the general features of the epithelium or the characteristics. They are closely opposed and adherent to one another by means of the spatial junction. They are usually avascular. They exhibit functionally distinct surface domain, namely the free surface, lateral surface and basal surface. All cells are rest on the basement membrane. Cells may display surface modification. So these one are the general features or the characteristic of the epithelium. Now epithelial tissue. So at the certain place in the body are found aggregated in close apposition with one another like epithelial cells but do not present at a free surface. This kind of the tissue are called the epithelioid tissue. Example parenchyma of adrenal gland and the lining cells of the testis, pituitary gland and parathyroid gland. So these one are the epithelioid tissue. Now epithelium create a selective barrier between the external environment and the underlying tissue. The epithelial investment serve among other roles as a selective barrier capable of facilitating or inhibiting the passage of specific substance between the exterior and the underlying connective tissue compartment. In the study of the various organs, it will be seen that any substance that enters the body as a metabolite or the discharge from the body as a waste product must literally pass through the epithelial cells and not between them. This one are the epithelial tissue. Now first function. Function of this epithelium, first there is a protection or the protective function from the abrasion and the injury. Second one, there is a absorptive function or the absorption of the nutrition from the lumen. Third one, there is a barrier mechanism, so it acts as a barrier for the excretion or the exchange in transcellular transport across the epithelial layer. And third, last one, there is a secretory function. So secretion of the mucus, hormone and enzyme. So these one are the main function of this epithelium for the protection from the abrasion and injury, absorption of the material from the lumen, secretion of the mucus, hormones and the enzyme, exchange transcellular transport across the epithelial layer. So these one are the main function, special organ of the sense and the transport. So this one are the function of this epithelium. Now classification. So classification, it is based on the shape of the surface cells, number of the cells layer. First, number of the cells layer, there is a simple epithelium if there is a single layer, and multi-layer if there is a multi-layer, name is given the stratified epithelium. So single layer, simple epithelium, and multi-layer, more than 2 to 3 layer, name is given the stratified epithelium. If there is a single layer but it looks like a multi-layer, this type of this epithelium, name is given this pseudo-stratified epithelium. And in between this stratified and the pseudo-stratified and simple epithelium, these one are the change the layer of the shape of the cells. In name is given this transitional epithelium. So this one are the classification of epithelium depending on the cell's arrangement and morphology. An epithelium may consist only one layer called the underlying simple epithelium. If there is multi-layer or the stratified or it can be pseudo-stratified. Unilayer simple epithelium, single layer of the cells resting on the basement membrane. It may be further classified according to the shape of the cells. And multi-layer or the stratified epithelium which consists of the multi-layer with the basal layer resting on the basement membrane. The epithelium is named according to the shape of the cells of the most superficial layer. In pseudo-stratified epithelium, single layer cells but give a false appearance of the stratification. So this one are the based on the classification. First you can see this diagram. This one are the simple squamous epithelium. Here there is a shape of the cells are the squamous shape. So name is given the simple squamous epithelium. The shape of the cell single layer but its shape is cuboidal. So name is given the simple cuboidal epithelium. Here there is a shape of the cells are columnar in shape, so name is given this simple columnar epithelium. So these are the single layers, so name is given the simple epithelium. Here there is a stratified or the more than 2 to 3 layers, so name is given the stratified. Shape of the cells are the squamous, so name is given the same stratified squamous epithelium. Here there is a 2 layer or 2 to 3 layer. Shape is cuboidal, so name is given the stratified cuboidal epithelium. Here there is a single layer but looks like a multi-layer, so this epithelium name is given the pseudo-stratified columnar epithelium. And here there is a change the epithelial layer, outermost there is a dome-shaped layer. If it is full of this bladder, there is a squamous epithelium. So this epithelium name is given this transitional epithelium. The simple epithelium based on the shape of the cell consisting them simple epithelial can be classified as a squamous, cuboidal and columnar. So this epithelium are the simple epithelium. Simple squamous epithelium first. You can see this sub-classification. Simple epithelium are the simple squamous, cuboidal and columnar. Stratified epithelium, stratified squamous, stratified cuboidal and stratified columnar. This one are the sub-classification of the epithelium. First, squamous epithelium. When the width of the cells are greater than in height, name is given the squamous. So if this shape are the squamous, name is given the simple squamous epithelium. It is composed of single layer or flattened cells. Their height being very little as compared to the width. Such as the epithelium is called the squamous epithelium. The cytoplasm of the cells form only a thin layer, the nuclei producing bulging of the cell surface. So this one are the simple epithelium. Second one are the cuboidal in shape. These are the simple cuboidal epithelium. Here is a height is more than the breadth. These one are the simple columnar. Now description of the simple squamous epithelium. It consists of single layer of the flat cells. Nucleus is oval, flat situated near to the center. Appear to be arranged like a floor or the tiles. Mesothelium, if it is lining epithelium of this serous cavity, and endothelium, it is lining inside the blood vessels. Location mainly you can see in this peritoneal cavity. Example, alveoli of this lung, free surface of the serous pericardium and the pleura and the peritoneum. Here it is called the mesothelium. Inside the heart, where it is called the endocardium, and inside the blood vessels and lymphatics, where it is called the endothelium. So this one are the location of this epithelium. And another, there is a simple squamous epithelium also found lining some parts of the renal tubules and in some parts of the internal ear. So this one are the location of this simple squamous epithelium. Now main function of this simple squamous epithelium, it help in rapid transport of the substance, filtration of the fluid and diffusion of the gas. So this one are the function of this simple epithelium. You can see this appearance of this nucleus. This one are the single layer flattened cells and squamous epithelium. The cytoplasm of the cells form only a thin layer. The nuclei produce bulging of the cell surface. In surface view, the cells have a polygonal outline that interlocks with those of these adjoining cells. In section, the cells appear flattened and their height being much less as compared to the width. Main function, it helps in rapid transport of the substance, diffusion of the gas and filtration of the fluid. With the electron microscope, the junction between the cells are marked by the occluding junction. The junctions are thus tightly sealed and any substance passing through the epithelium has to pass through the cells and not between them. So these are the simple squamous epithelium. You can see this are the example of this lung alveoli. Here it adjacent there is another capillary and it helpful for the transfusion of the gas. So this one are the simple epithelium. It looks like a tiles. So when you can see on surface view, it looks like a tiles. So here there is a adjacent between these two surface, there is a tight junction. This tight junction name is given the zona occluder. So here there is a occluding junction in between these two surface, two epithelial cells. Now simple cuboidal epithelium. Simple cuboidal epithelium description. The cells appear cuboidal in shape. Nucleus is round and centrally placed. All nuclei are arranged at the same layer. In view from top, cells are hexagonal in shape. So location of this simple cuboidal epithelium mainly you can see in follicle of the thyroid gland, in the duct of the main gland and on the surface of the ovary, choroid plexus and inner surface of the lens, and the pigment cell layer of the retina. The cuboidal epithelium with the prominent brush border is seen in the proximal convoluted tubules of the kidney. So these are the location of the simple cuboidal epithelium. Now function of the simple cuboidal epithelium, mainly it helps for this mainly concerned with this secretory, absorptive and excretory function. Secretory and absorptive, mainly concerned with the secretory, absorptive and excretory function. You see this diagram, example of this thyroid gland, and here this epithelium are the simple cuboidal epithelium. When the height and the weight of the cells of the epithelium are the more or less equal, they looks like a square section. It is described as a cuboidal epithelium. The nuclei are usually round and centrally placed. In section view, cells appear cuboidal in shape. When viewed from the surface, cells are hexagonal in shape. So this epithelium are the simple cuboidal epithelium. Now salivary duct is also the example of this simple cuboidal epithelium. Here you can see this cuboid shape. So these are the appearance of this single layer of the cells and looks like a cuboidal shape. So this one are the simple cuboidal epithelium. You can see in follicle of the thyroid gland, duct of the main gland. So this one are the duct of this gland. Here you can see the simple cuboidal epithelium. On the surface of the ovary, incubator and choroid plexus, the inner surface of the lens and the pigment cell layer of the retina. So cuboidal epithelium with prominent burst border is seen in proximal convoluted tube. Now simple columnar epithelium. So description of the simple columnar epithelium, the cells are the much taller than their weight. Nuclei are elongated and located in this lower half of the cells. Nuclei are placed at the same level in the neck-bearing cells. In vertical section, cells of the epithelium are rectangular. On surface view, cells are the polygonal. So simple columnar epithelium, you can see here you can see this slide of this simple columnar epithelium height, it is more than the width. When the height of the cells of the epithelium is distinctly greater than their width, it is described as a columnar epithelium. Nucleus are elongated in location in lower half of the cells. Nucleus of the O cell are placed at the same level. In vertical section, the cells of the epithelium are rectangular on surface view. In transverse section, the cells are polygonal. So this epithelium are the simple columnar epithelium. So columnar epithelium can be further classified according to the nature of the free surface of the cells. They are based on the simple columnar epithelium, and in some situations the cell surface has no particular specialization. A simple columnar epithelium non-ciliated line the mucous membrane of the stomach and of the large intestine. They may even contain the goblet cells. So goblet cells are the glandular simple column epithelial cells which perform the major function of the secretory mucus. The name goblet is derived from due to the special shape of the cells. So it has a narrow base and expanded apical portion. So this cell's name is given this goblet. You see this slide of the stomach here, you can see the empty looking space. These are the simple columnar epithelium, and you can see whole GIT except the lower end of this esophagus and this anal canal and rectum. Rest of this part of this GIT is covered by the simple columnar epithelium with goblet cells. So goblet cell is derived due to the special shape of these cells. It has narrow base and expanded apical portion. Since the mucus gets washed away during this rotting HN stain or the humectant sign eosinophil stain, staining the upper expanded portion appear empty. So it looks like a empty looking space are the goblet cells. So light staining, these cells acquire the correct shape and therefore the goblet cells. The columnar epithelial cells can be found in lining of this ear, nose and on the taste bud of the tongue. These cells are designed to respond to stimuli. So ciliated columnar epithelium can be found in lining of the some organs such as the fallopian tube and in the lung cilia. Specialized bundle portion which can be moved together help columnar epithelium cells are rather thick, which allow them to withstand mild amount of this damage, and microvilli increase the surface area of this absorption. So these cells are this simple columnar epithelium. Now another cells of this simple columnar epithelium with goblet mucus secreting cells, small intestine, ileum and showing tall columnar cells with nucleus and striated border or the microvilli facing in the lumen, goblet cells with mucus and showing the nucleus. But you can see this height of these cells is larger and there is a microvilli. At some place the surface is covered with this microvilli. So microvilli along the microvilli are visible only with electron microscope. They are seen in striated border with light microscope. When the microvilli are arranged regularly, brush border. When the microvilli are irregularly placed. Main function of this ciliated columnar epithelium, in some situations the cells wear a cilia lining the epithelium of the fallopian tube. So sometimes there is a cilia or sometimes there is a microvilli. So if there is a ciliated columnar epithelium, you can see in this lining epithelium of the fallopian tube are these structural wear cilia, and in some place surface cover with microvilli. Although the microvilli are visible only with electron microscope and seen in striated border. So main function of these are mainly columnar cells have a secretory and absorption function. In intestine, many of them secrete the mucus that accumulate in this apical part of the cells, making is very light staining. These cells acquired its character shape for the goblet cells. So these are the empty looking cells are the goblet cells. Here you can see with mucus secreting cells or the goblet cells, and these are the ciliated border. So some the border are the microvilli facing the lumen of the goblet cells, mucus showing in nucleus. Here you can see this nucleus of this goblet cell. This one are the tall columnar epithelium. So ciliated columnar epithelium can be found in lining of the some organs such as the fallopian tube and in the lungs. Cilia are specialized bundle of the protein which can move together and help proper material in one direction. And columnar epithelial cells are thick, allow them to withstand mild amount of the damage. Microvilli it increase the surface of for the absorption. Now further classified according to the nature of the free surface of the cells: simple columnar epithelium, ciliated columnar epithelium, striated border and brush border. So these one are the secretory function, and microvilli increase the surface area. So this one are the example of the simple columnar epithelium. So simple columnar epithelium is located over the mucous membrane of the stomach and the large intestine. Columnar epithelium with striated border is seen typically in small intestine with brush border in gallbladder. Ciliated columnar epithelium line most of the respiratory tract, the uterus and the uterine tube. It is also seen in efferent ductules of the testes, parts of the middle ear, and in auditory tube, and epidermal lining of the central canal of the spinal cord and the vertical of the brain. In the respiratory tract, the cilia more mucus accumulating in the bronchi toward the larynx and the pharynx. When the excessive mucosa is brought out sputum during the coughing in the uterine tube, the movement of the cilia helping passage of this ova toward the uterus. So this one are the microvilli and ciliated epithelium. Now pseudostratified epithelium. Pseudostratified epithelium, it is not true stratified epithelium but appear to be stratified. Normally in columnar epithelium, nuclei lies in row towards the basal part of the cells. Sometimes nuclei appear to be arranged two or more layers of and giving the impression that epithelium is more than one cell thick. So this one are the pseudostratified epithelium. Here you can see this basement membrane and they all single cell of the layer and their nucleus is located in 2 to 3 layer. Looks like a 2 to 3 layers. So this epithelium name is given the pseudostratified layer epithelium. It is not a true stratified epithelium but appear to stratified. All the cells are in contact with basal lamina but only few cells reach the surface. So tall cells have narrow base and broad apical part but short cells have broad base and narrow apical part and nucleus are located at the broad end of the cells which gives appear as many layers. So they are arranged in 2 or 3 more layers giving impression that epithelium is more than one cell thick. The epithelium may bear cilia or ciliated epithelium and may contain goblet cells. The cilia are capable of the movement. At some time, this epithelium may display stereocilia. So main function of this pseudostratified epithelium, the tall columnar cells secretory in nature, while the short basal cells are the stem cells, which constantly replace the tall cells. The cilia help in clearance of the mucus and stereocilia help in absorption. So this one are the pseudostratified epithelium. So cells are attached to basement membrane but are of different height, hence not all reach to apical surface. Because of this, nuclei of the cells are the different level. Epithelium can be ciliated or the non-ciliated and it may be contain goblet cells. So these are the location, mainly respiratory epithelium, function, protection of this underlying tissue, ciliary movement, remove the mucus while goblet cells secrete the mucus. The tall columnar cells are secretory in nature while short basal cells are the stem cells which constantly replace the tall cells. So this one are the example of the pseudostratified epithelium. So non-ciliated pseudostratified epithelium is found in some parts of the auditory tube, duct deferens and the male urethra, membranous and the penile part. And ciliated pseudostratified columnar epithelium is seen in trachea and in large bronchi. Pseudostratified columnar epithelium with stereocilia, long microvilli is seen in epididymis. So this one are this epithelium pseudostratified or the stratified epithelium, pseudostratified epithelium. So here you can see this ciliated pseudostratified epithelium. You can see in this slide of this trachea. So pseudostratified columnar epithelium with stereocilia or long microvilli is seen in epidermis, but ciliated pseudostratified columnar epithelium is seen in trachea and this large bronchi. With goblet cells in trachea, here you can see this slide of this trachea. Now transitional epithelium. So transitional epithelium, it is multi-layer epithelium with 4 to 6 layer of the thick. So this epithelium are the it differ from the stratified epithelium. In that cells the surface are not squamous. Deeper layer cuboidal and columnar. Middle layer polyhedral, pear shape and superficial surface layer large umbrella shape. So these are the transitional epithelium. So this is multi-layer epithelium with 4 to 6 cells thick and which can contact and expand as needed. Now location. So location of this transitional epithelium mainly you can in urinary bladder. So it is found in renal pelvis and the calyces in the ureter and urinary bladder and part of this urethra. Because of this distribution, it also called the urothelium. So main function, the presence of occluding junction, transmembranous plaque form an effective barrier that is prevent the absorption of the toxin substance of the urine. So function of this transitional epithelium at the surface of the epithelium, the plasma membrane are unusual embedded in lipid layer of this membrane. There are special glycoprotein. It is believed that this glycoprotein make a membrane intervening resistant toxin effect substance present urine and thus afford the protection to adjacent tissue. Transitional epithelium cells stretch rapidly. So this one are the epithelium. Here you can see this diagram. Stratified squamous epithelium. This one are the transitional epithelium. This one are ciliated cuboidal epithelium with goblet cells and cilia it present. So this one are this ciliated epithelium. Basal layer there is a basal cells, basement membrane, and this one are the goblet cells, empty looking cells. The surface there is present the cilia. So this one are the ciliated simple columnar epithelium. So stratified multilayer transitional there is a change the shape of the cells. So this epithelium name is given the transitional epithelium. Now stratified epithelium. Transitional epithelium of the ureter. Here you can see this outer shape of the cells are the dome shaped cells. So transitional epithelium. Here you can see this diagram. This one are the basement membrane. This epithelium are the transitional epithelium. So this is multilayer epithelium with 4 to 6 cells thick and which can contact the it called the transitional because it transitional between the stratified squamous and stratified columnar epithelium. It differs from stratified squamous epithelium in that the cells at the surface are not squamous. The deeper cells are the columnar and cuboidal, and middle layer are the middle made up of these polyhedral or the pear-shaped cells. So this cell's name is given the surface layer enlarged and often shaped like a umbrella. So this type of this epithelium name is given this transitional epithelium. Superficial cell layer जो है उसमें lumen only differentiate layer of this epithelium है and it provide the impermeable barrier between this lumen and this bloodstream. And urinary bladder is seen in cells of the transitional epithelium can be stretched considerably without losing their integrity. When stretched, it appears to be thinner and cells become the flattened. So this epithelium are the transitional epithelium. So during the relax ureter, there is a flattened outer layer is flattened. Simple slide for distended ureter. This outermost layer it is dome shape or the umbrella shape. Now stratified squamous epithelium. Stratified squamous epithelium. This type of this epithelium is made up of these several layers of these cells. So stratified keratinized stratified squamous epithelium and non-keratinized stratified squamous epithelium. So stratified squamous epithelium is divided into these two, keratinized and non-keratinized. So it is stratified more or this one layer of the cells. So it classified on the stratified squamous epithelium. Here there is a non-keratinized stratified squamous epithelium. Here keratin is present. Name is given this keratinized stratified squamous epithelium. So according to its shape stratified more than one layer of the cells, it is classified according to the cell shape of the superficial layer of the squamous, cuboidal and columnar. If the outermost layer is squamous, so this epithelium name is given the stratified squamous epithelium. So stratified squamous epithelium is thick and they made up of the several layers of the cells. The cells of this deepest or the basal layer rest on the basement membrane. They are usually columnar in shape, lining over the columnar cells. there are polyhedral and cuboidal cells. As we pass towards the surface of the epithelium, these cells become progressively more flat, so that the more superficial cells consist flattened squamous cells. Stratified squamous epithelium is found over those surfaces of the body that subject to friction. As a result, it helpful for the protection. Most superficial layers are constantly being removed and replaced by the proliferating of the cells from the basal layer. This layer therefore show the frequent mitosis. Stratified squamous epithelium can be divided into two types, non-keratinized and keratinized. First, non-keratinized epithelium. So non-keratinized stratified squamous epithelium, where the surface of the squamous epithelium remain moist and the most superficial cells are living, the nuclei can seen in them. This kind of the epithelium is described as the non-keratinized stratified squamous epithelium. When you can see in this type of this, here you can see the outermost layer there is a keratin are absent. So this name is given this non-keratinized epithelium. Also name is given the wet epithelium because usually wet and is found in lining the mouth, oral pharynx, esophagus, through vocal fold and the vagina. So these are the stratified squamous non-keratinized epithelium. And stratified squamous keratinized epithelium you can see in skin. Also name is given this dry. So similar to the non-keratinized epithelium except that epithelium surface is dry and most superficial layer of the epithelium are composed of the dead cells when nuclei and the cytoplasm have been replaced with the keratin. This kind of this epithelium constitutes keratinized stratified squamous epithelium. So here there is example, epithelium cover the skin of the whole of the body and from the epidermis. So main function, there is a protection in nature. Keratin prevent the dehydration of underlying tissue. So this epithelium are stratified squamous epithelium, non-keratinized and keratinized. Here you can see the stratified squamous epithelium. So this one are the squamous epithelial cells, these are the stem cells, basal layer, and this one are the connective tissue. This slide are epithelium are the stratified squamous epithelium. Here you can see also protective nature of stratified squamous epithelium. Location, mainly there is a non-keratinized wet epithelium, oral cavity, oropharynx and esophagus and vocal cord, and dry epithelium you can see in skin. So example of this epithelium cover the skin of the whole body and from the epidermis. So it is main function protective, prevention of the absorption of the water, prevent dehydration of underlying tissue. Now stratified cuboidal epithelium. So cuboidal epithelium description consists two or the more layer of this columnar or the cuboidal cells. Mainly stratified cuboidal epithelium consists two layer of these cuboidal cells and found in duct of the sweat gland. So main location there is a duct of the sweat gland. A stratified columnar epithelium main function is protective and secretory. So here you can see the stratified cuboidal epithelium. You can see in sweat gland, duct of the sweat gland. The stratified columnar epithelium, two or the more layer of the cells, superficial layer of this columnar. Mainly you can see in the stratified cuboidal epithelium composed of these two layer polyhedral and cuboidal layer. Superficial layer are columnar cells found in conjunctiva of this eye, certain large excretory duct and like the pancreas and salivary gland and region of the male urethra. Main function to provide the passage for the secretion act as a barrier. So stratified columnar epithelium, like all stratified epithelium, it protective in function and it also help in conducting the secretion of the gland. So this one are the stratified columnar epithelium. You can found in salivary gland and region of this male urethra. So here there is a, you can see this free surface nucleus, they are rest on the basement membrane. A stratified shape is cuboidal columnar cells, so name is given the stratified columnar epithelium. So these are the, looks like a slide under the stratified columnar epithelium. So stratified columnar epithelium mainly you can see in large excretory duct found in conjunctiva of this eye and pancreas and salivary gland and and region of the male urethra. A stratified cuboidal epithelium you can found in duct of this sweat gland. So